Hello everyone, welcome back to our third component of disaster response. In this segment, we will be focusing on triage. Without any further ado, welcome to 5 things you need to know on triage. Number 1. Triage principles. Triage comes from French word for to sort. Triage is the process of classifying patients according to urgency to receive treatment. There are 3 principles of triage. Number 1. To do most good to most numbers of victims. Number 2. Triage is a dynamic process in disaster and should be repeated at every level. For example, at the scene, before transportation to hospital in the ED, and before sending the patient to operation theatre. Number 3. To treat victims according to priority. In field triage, we use START. START stands for Simple Triage and Rapid Treatment. In START algorithm, there are 3 components being assessed. They are RPM. R stands for respiration, P stands for perfusion, and M mental status. Number 2. Triage system. There are 2 triage systems that can be used in disaster: START triage and sieve and sort triage. START triage was developed in 1983 by Newport Beach Fire and Marine Department, California, in United States of America. 3 components are being evaluated. They are respiration, perfusion, and mental status, RPM. The second system is triage, sieve, and sort. It was developed by Major Incidents Medical Management Support (MIMS) in the United Kingdom. Triage sieve is used to move disaster victims to casualty clearing station. A score will be calculated in triage sort, and priority can be assigned, and victims will be distributed to appropriate receiving hospital. For more information on this triage system, please proceed to MIMS website. Number 3. Triage categories. There are 4 color-coded triage categories: red, yellow, green, and black. Red is immediate or first priority. The victims sustain injuries that can cause immediate life-threatening. The injuries sustained are affecting airway, breathing, and circulation. These victims require immediate intervention and transport to the hospital. Yellow is urgent or second priority. Injuries sustained by the victims are potentially life-threatening injuries. The injuries are affecting circulation, neurological, and ventilation problems. Green. Victims triage under green category are the third priority. They sustain relatively minor injuries such as cuts, bruises, and wounds. They are sometimes called the walking wounded. Black is for victims that were dead or expectant. They are those who are deemed unsalvageable and unlikely to survive. Our aims are for palliative care and pain relief for these victims. There you have it, red, yellow, green, and black triage category. Number 4. How to perform START triage. First and foremost, call the victims to come to you. For example, "Hello everyone, help is here. I'm Farina and the rest of medical team are here to help. If you can stand and walk, kindly walk towards me." So, are the victims walking? If yes, triage them as green tag victims. If they are not walking, approach each and every victims, starting from the closest victims to you. Now, we are going to use RPM, respiration, perfusion, and mental status. So first step, check the respiration. Is the victim breathing? If no, triage black to the victim. If the patient is breathing, do check the respiratory rate. Is it under 30 breaths per minute? If it's more than 30 breaths per minute, triage red to the victim. If the rate of respiration is below 30 per minute, check for palpable radial pulse. This is the P component, perfusion. If there is no palpable radial pulse, triage the victim as red. If there is palpable pulse, move to the third component, M, for mental status. Mental status can be assessed by the ability of the victims to obey simple command. For example, can you please raise your right hand? If the victims unable to obey simple command, triage the victim as red. If the victims able to obey simple command, then only the victims can be triaged as yellow. So, let us now recap on what we have learned. When you arrive at disaster scene, the first thing you need to do is to call the victims towards you. If the victims are able to walk, also known as the walking wounded, triage them as green. We are now left with victims who are unable to walk. What we need to do next is to assess RPM, respiration, perfusion, and mental status. We always have to follow the order: number 1, respiration, number 2, perfusion, and lastly, mental status. Number 1, respiration. If the victims are not breathing or apneic, triage them as black. If the victims are breathing, count the respiratory rate. If it's more than 30, triage them as red. Please do not check for perfusion and mental status in these victims once you have triaged them as red. Move on to the next victims for triaging. If the respiratory rate is less than 30, please assess the next component, which is perfusion. If the radial pulse is not palpable, triage the victims as red. Again, do not check for the next component, mental status, in victims that has been triaged red at perfusion. If there is palpable pulse, please assess the third component, which is mental status. If the victims unable to obey simple command, triage the victims as red. So, when touch yellow, yellow tag victims are those who are unable to walk and who has respiratory rate less than 30, palpable radial pulse, and obeying simple command. When all three components of RPM are fulfilled, then only the victims will be triaged as yellow. Number 5. When to perform triage? Triage is a dynamic process. In disaster, triage is done at every level. At the disaster scene, before transportation to hospital, at the emergency department, and before transporting to operation theatre. We have now completed the principles of disaster triage. Thank you for watching all 3 parts of the video. I hope you enjoy watching them. So, are you ready for the next disaster? Thank you for watching.